Hi, my name is Jennifer Davis, and today we are going to talk about chronic kidney disease. So what is the purpose of a kidney? Your kidney is not just one big filter. It's actually full of lots of small little filters. And these filters filter about 1 to 2 quarts of waste from your blood every day. They are also responsible for keeping electrolytes stable in your body, making sure you don't have too much potassium or calcium floating around in your blood. They also are responsible for releasing hormones to help us maintain our blood pressure, to help us make red blood cells, and also to help our bones stay strong. And these are pretty important tasks that our kidneys have. So they're very important to us. So minorities at risk. We're focusing on the minorities because they actually have the highest risk of chronic kidney disease over Caucasian Americans. So compared to white Americans, African Americans are 4 times more likely than the white Americans who have chronic kidney disease. With Native Americans, they are 1.8 times more likely, and Hispanics are 1.5 times more likely. Some risk factors involved with chronic kidney disease. There are modifiable risk factors along with non-modifiable risk factors. And this just means the non-modifiable ones are ones that we can't control, such as our race, our age, and genetics. If our family is predisposed to chronic kidney disease, then that puts us at a higher risk. So we need to look at those. If you already have some of those, if you're already a minority and you're 65 or older, and your parents or some family members have kidney disease, then you may really want to take a look at your modifiable risk factors. These modifiable risk factors are things that we can change, which is our blood pressure, our sugar. If we're diabetic, we don't want to continuously have high blood sugars. Our weight, if we're overweight, that's not good for our kidneys either, and also smoking. So how do we take control? We're going to monitor our blood pressure. If you know that you have high blood pressure, you want to have a log. You want to take your medications like you're supposed to if you have prescription medications. And while you're tracking your blood pressure, if you notice that it is on the higher side or it's always high, then you really want to talk with your primary care physician to see if you need some adjustments with your medication. Maybe you need an extra medication. So that is really important with chronic kidney disease, because if you have high blood pressure, what happens when the blood is circulating through your kidney is the pressure is so high that the little filters that are in your kidney can't take the pressure, and they cause damage. The pressure causes damage to the filter. And once those filters have damage and they're gone, there's no replacement. They don't regenerate. Once they're gone, they're gone. And we only have so many. So we really need to watch our blood pressure so that we're not destroying our filters in our kidneys. Also, our blood sugars. If you're diabetic, it's very important also to keep a log of your blood sugars, to keep in touch with your primary care physician. Make sure that your blood sugars are under control. Take your medications as you're prescribed. Those 2 diagnoses of high blood pressure and diabetes are the 2 biggest causes of chronic kidney disease. So if you have those 2 diagnoses, it's vital that you take care of yourself and your blood pressure and your sugar, because if you don't, then it's almost inevitable for you to have chronic kidney disease. So really take care of those 2 things. Another important thing to watch is the salt in your diet. So when you have too much salt in your blood, it will draw water. And so then you have too much volume in your blood for your kidneys to filter, and that they already have a lot to do. So now you're just creating more work for them, and that can also cause damage to your kidney. So we really want to watch that salt. By watching the salt, that will also help your blood pressure because you won't have as much volume in there creating more pressure. So that's also like 2 birds with 1 stone. So watch your salt intake. Also, our activity level. We want to keep a good activity level. Don't sit on the couch and watch Judge Judy all day. Keep moving. When things sit around, they get rusty, and so we want to keep them moving, keep them grooving, and everybody has a good day. Stop smoking. It's not good for anyone. It's not good for you. It's not good for the people around you, so don't smoke. Also, something that people might not realize is the use of NSAIDs can affect your kidneys. These are medications such as aspirin, ibuprofen, things that are over the counter that you may not think might harm you, but if you take too much, or if you already have chronic kidney disease and you're still taking these medications go through your kidney. They're filtered through your kidney. Your kidney might already have issues filtering things that it needs to anyway. So when you add this to their workload, that might cause extra kidney damage and giving them extra work. Stages of chronic kidney disease. There are 5 stages, and these are categorized by your lab levels, and by looking at your lab levels, they're able to judge the severity of the kidney damage involved. So stages 1 and 2, you really don't have very many symptoms. You can walk around and not know you have it unless you're screened for it. So that's something where when you talk to your primary care physician, you really want to mention it so that they can screen you. It's not hard. There's a urine test and a blood test, and that's it. It's not a big procedure to tell if you have kidney disease. So that's something that can be done with just one doctor's visit. So if you catch it early in stages 1 and 2, that's the best chance to know, like, you have a problem and we need to stop it. We need to stop the progression of it. So that's even more motivation for you to make changes. Stages 3 and 4 are the stages where you really start having some symptoms. Your kidneys have significant damage to them, and they're really not filtering out things ideally from your blood. So these stages, you'll have more fatigue, you'll have muscle cramps, you'll have swollen feet and ankles, puffy face. So, and you just overall will start feeling kind of crappy. So you really want to keep this from happening. So if you can get diagnosed in stage 1 and 2 or prevent any diagnosis, then that's really the best thing. If you still have issues with chronic kidney disease and you don't catch it till really late, or if you're unable to control your risk factors and your ways to prevent the progressing, then you'll end up in stage 5. And stage 5 is where your kidneys just can't keep up anymore. So you need dialysis. And dialysis is basically just going to a machine, and the machine has a filter that works as a kidney. And your blood is pulled out of your body, runs through the filter, and back into your body, just as it is in your kidneys just outside of your body. So just a little bit about dialysis. It is required usually about 3 times a week. If you have issues such as illness or you're pregnant, different things like that, then you may have to go more than 3 times a week. But usually it's about 3 times a week. And these visits are not optional. If you don't go, you will end up in the hospital. So it's not like, well, I don't feel like going to dialysis today. No, you have to go. It's not an option. Also, on dialysis, once you're started, your life expectancy is about 5 to 10 years. This is because you're at a higher risk for infection. A lot of dialysis patients face this problem because every time you go to dialysis, that 3 times a week, they're poking a hole in your body and taking your blood out of your body, and that exposes you to germs and that risk for infection. So that becomes a problem. Also, you run the chances of too much fluid being pulled off or not enough, and that just can get into some sticky situations. So we want to try to avoid dialysis if at all possible. Also, when you get into the stage 5, you can be evaluated for a kidney transplant. Now, these transplants are, the chances of getting a transplant are going down with each year. Not as many people are signing up for organ donation, so the kidneys are getting more scarce. So if you can prevent this at all, then that would be the best thing. If you can't and you're getting evaluated, they're going to screen you. And the screening really judges how well you manage your medications. Because once you have a transplant, you have to take medications for the rest of your life. And if you don't take them, then your body will reject that kidney. And they're not going to take the chance of giving someone a kidney who can't take their medications. So if you have high blood pressure and you've had it and you didn't control it with the medications that you were prescribed, and that's why you're on dialysis, then your chances of getting that kidney are even lower, because you have to prove to them that you can make an effort and you can take your medications how you're prescribed, because they don't want to give kidneys to someone who's not going to take care of it when there are other people who will take care of it. So that's really part of their screening process. So you really want to keep that in mind when you're trying to prevent progression of your kidney disease. Some resources that we have, your primary care doctor, talk with them, get screened, see if you have any damage or if you need to make any changes to your lifestyle, make sure your blood pressure is under control. They're a very key player for you. Also a nephrologist if you do have kidney damage already. The nephrologist is a specialist with the kidney, and that's all they worry about is your kidney, and things to make it better. So they're really important if you have chronic kidney disease or any kind of kidney damage already. A nutritionist is important if you want to make changes in your diet. They can really help you and guide you in the right way and let you know things that are good to eat for your disease or things that aren't, things to avoid. Another thing is support groups. It's always nice to have a friend who knows your situation, and when they've been through it themselves, that really can give you some motivation. So those are always important. Some foundations that are here on this slide are the National Kidney Foundation and American Association of Kidney Patients, and there's some web addresses there that have a lot of information on kidney disease, how to prevent it, how to prolong it. So those are some interesting things to check out. Let's do a quick review. These are some true and false statements. And let's see how much we learned from our slide today. So chronic kidney disease can be prevented, true or false? Yes, this is true. You can prevent kidney disease by taking care of your blood pressure, your sugar. Now, if you have a genetic disorder, that might be something different, some non-modifiable risk factors. Those we can't change, but we can try to prevent chronic kidney disease. Next one, my blood pressure does not affect my kidneys. That is absolutely false. So your blood pressure has a big impact on your kidney function. Remember we talked about the pressure in our blood. It's going through the kidney. That can damage the filters there. And once we damage those don't come back. Our blood sugar control can save kidney function. And yes, that is true. If we can control our blood sugar, that really helps our kidneys out. And so we really want to do that, especially if we're diabetic. The next one we have is processed foods are low in sodium. True or false? That is absolutely false. Processed foods are full of sodium. So we really want to avoid those foods to help with our blood pressure and help with our kidney function. The next one is, once I have chronic kidney disease, I'm doomed. No, that's not true. That is false. If you have chronic kidney disease, there are ways to slow down the progression. There are ways to manage it. So it is very important that if you do have it, to seek those resources that we talked about and to talk with your primary care physician and your nephrologist to find better ways to slow the progression. I hope you enjoyed the presentation today, and I hope you are able to take something home that you've learned. I hope you have a nice day. Thanks.